So the mercury filling is this silver filling that you have in your mouth, and it's 50% mercury. That got me thinking, mercury is the most toxic non-radioactive element known to man. How can I possibly place this in my patients? We have to bring somebody specialized to remove it as highly toxic waste. So I thought, wow, crazy. How can I put that in the mouth of patients? So your teeth have an immune system. They are alive. They are just hard as stone from the outside. So inside, we have an immune system in there. We have an autonomic nervous system in there. We have a lymph supply. We have everything that qualifies as a regular organ. This is why it's so critical for your nervous system and immune system, because if anything is disrupting it, it could be that tooth here that is chronically infected, that makes your shoulder frozen or your knee problematic. And there is studies showing that if you have a phone call with your cell phone and you have a mercury filling, we have an increased mercury vapor output after this phone call or during that phone call. Or if you have a titanium implant, it just heats up while doing the phone call, up to 3 to 4 degrees Fahrenheit.
Dr. Dominik Nischwitz, or Dr. Dom, is a world-renowned specialist in biological dentistry. He is the current Vice President of the International Society for Metal Free Implantology, an international speaker and best-selling author of the book It's All in Your Mouth. Dr. Dom has also trained in naturopathic and functional medicine and practices from his specialist clinic in Germany. In today's podcast, focused around the statement, health starts in your mouth, we'll be finding out what biological dentistry is, the role of the oral microbiome in health and disease, the problems associated with amalgam fillings and root canals, as well as the most effective ways to support oral health naturally. Thank you so much for joining us today, Dr. Dom from Germany.
Thank you very much, Bobby, for having me.
It's a pleasure. It's an absolute pleasure. Very much looking forward to this topic today. And I thought a really good place to start really was just a little bit about you. Obviously, you're trained in dentistry and you're in this particular area, biological dentistry and health optimization. So what triggered this sort of change? What triggered this interest in such a holistic approach?
I think what it really triggered was my personal health story that started early. So I was always very athletic as a kid, but never 100% fit. And obviously did a lot of, basically crashed my body until I was 21. So I had to rebuild it. And doing this while I was studying dentistry probably laid the foundation of me being interested in optimal health. There was no term kind of like health optimization 20 years ago, but I just had to rebuild my body because I really was suffering back then. It was early 2000s, and studying at the same time, I learned about biochemistry. I learned about all these things while working out, training, being interested in supplements. So the dentistry itself wasn't really my passion or anything. I just studied it as an entrance card, I realized later. And then after university, when you have to do your assistancy, I wanted to become a surgeon, oral surgeon. And my mentor or my first doctor boss, he was still placing amalgam fillings, and I personally couldn't do it from an aesthetic point of view. And I knew from my dad that amalgam fillings somewhat are not the best choice or really toxic. And this is when I had to study about it, because I told my boss, sorry, I'm not going to do amalgam fillings because of these reasons. And then when I looked into amalgam, heavy metals, detoxification, everything clicked for me. It was finally the piece that I was missing, that I was looking for. Oh, wow, I can help my patients getting healthier and do the nice craftsmanship that I learned in university, because this was the missing part in university. Something I didn't know what it was, but then I realized it's all about health, and this is not what you get trained in dentistry, in conventional dentistry. So I got addicted and found good mentors online, Dr. Dietrich Klinghardt, Dr. Mutter, a ton of people. And basically for 5 years, I was just traveling the world and learning from the best and trying to develop an overall concept. I had this idea of let's say, a holistic center in my mind. And I also wrote it down. I have this idea piece, visual, still in my folder. And it was saying within 5 years, I'm going to have a center. And it actually happened. And in 2015, I opened my first center for biological dentistry 2.0 here in my hometown, Tübingen, together with my father, which is still here, but it's growing and growing. And it's now more like a health optimization center where we start in the mouth. So that's kind of like a rough cut to how it all started.
Interesting.
So I was always interested in optimal health.
And so your dad is a dentist as well?
My dad is a dentist too. And no, I never wanted to become a dentist because my dad was a dentist, because I wanted to become skateboard professional. And I could not understand why my dad was in the clinic all day long and I never saw him. I thought it must suck if you always work.
Yeah.
I didn't realize that it was his passion and that it's really fun to practice. So for me, just by accident, I was thrown into dental clinic as a civil servant. And there, I don't know, I think he thought I was a student, the doctor I was working with, and he let me just pull out teeth as a civil servant,
Wow.
like right after school. It was like pulling out teeth from, let's say, general anesthetized patients, and I had fun doing it, so I just applied. I didn't think it through. It just happened.
That's
And
amazing.
yeah, it's a long time ago, so I graduated 15 years ago already.
Wow. But it
And
served you well to get to where you are now.
it is actually the entrance card. And this is what my dad told me, luckily in the last semester still, because I wasn't sure if it's good or not. He's like, just your entrance card. And this is what it was. For me, it was just the entrance card. And from there on, I started to build all these things, learn everything. I'm just a curious person. I'm very skeptical. I'm the guy who always asks, why am I learning this? And is there maybe even another thing? So I learned neural therapy, everything about nutrition, food, and supplementation, mindset, everything on every level, because it's all connected. It's all about optimal health for body, mind, and spirit. I learned it on my body. I learned it with my own chronic health issues. And I'm very grateful nowadays that I resolved those and that I can give something back to all you guys out there suffering. Because I was depressed basically when I was 21, and this was early 2000s. Nobody could help me then. So I had to find solutions for myself. And if you back to normal, let's say to square one or to zero, then you get addicted. And then I wanted to see more and more and become even healthier and younger and more vibrant. And yeah, and then
That's
you
brilliant.
learn, and you have a folder full of certifications. And yeah, and my idea is just I like to create things that help other people.
That's
And this is
great.
how the clinic started. I'm the owner and founder of a supplement company that I actually started before my clinic in 2014, then DNA Health and Aesthetics in 15. We're now building a separate tract in the backyard right now, while we're speaking, a health optimization center right next to it. And we will maybe talk about it.
Yeah,
So
let's talk about it.
see, I'm just all about optimizing health, and becoming an expert in health optimization is probably the goal.
I think
it's already there. So
I think so. And I think you've already answered a little bit of the question I wanted to ask you next. But just to be really clear for our listeners, if you were to sort of summarize the difference between conventional standard dentistry and biological dentistry, I know people talk about holistic dentistry. What is the difference between these different things?
Yeah. First of all, conventional dentistry and holistic dentistry is a term that I try to avoid. It's the same in Germany. There's also the term holistic dentist, and actually a biological dentist is a holistic dentist. But my goal was to resonate with general dentists, young and wild dentists like myself, because I wanted to change something. And holistic dentist has this bad rep to it that regular dentists, conventional dentists, initially think he is not good at his craftsmanship. It's kind of like a bad word.
Right.
That's why we had to go with something new. So I call it biological dentistry or BioDentistry 2.0, and just wanted to make it more research based, more science based, less esoteric. Even though I'm a big fan of esoterics, but conventional dentists are kind of very stubborn at the beginning, coming from universities. So you have to come with research, and I'm also very interested. So I'm the guy who's a lot in PubMed and researches everything. But I just wanted to have something new that will be the next level, because I have nothing against conventional dentistry. I just think it's outdated. Mm-hmm. Conventional dentistry basically is what you study, and what you learn is how to repair teeth and how to manage pain and how to maybe clean, oral hygiene, and maybe even a little bit of aesthetics. But that's it. Teeth are just for biting. They're not seen as part of your body, like a live part of your body, like these little tiny organs that they are. It's 32 tiny little organs that are directly connected to your brainstem. Basically, the teeth in your mouth is an extension of your brain. So what a biological dentist, how I define it is biodentistry is the overlap of the high-tech dentistry
Yeah.
with functional medicine or integrative medicine
Yeah.
and health optimization slash biohacking.
So
And the focus is optimal health, and we start from the mouth.
I was about to say, so really it's that underpinning philosophy. I mean, obviously in conventional medicine, we often hear of this phrase that health is the absence of disease.
Yeah.
And what we're trying to do here is optimize health. So there is a clear
Yes.
difference in the underpinning philosophy.
It's exactly the same thing. In my opinion, at one point, all us health coaches, naturopathic doctors, dentists, all these different words should be one thing, somebody who knows how to optimize their patients.
Yeah.
We don't even think about sickness or disease or illness or prevention of it. We just optimize it. And obviously, it's all about all about epigenetics and about stressors. And conventional dentistry just puts a lot of chronic stressors in your body that you cannot biohack your way around. They're
Yeah.
just in your mouth 24/7 installed. And you didn't come to this earth with a root canal or metals or cavitations. So that's just epigenetically wrong. It's unnatural. And this is something that we have to remove at one point. That's what I call a high-tech dentistry, because we use biocompatible materials, all neutral. But then in order to help your body really heal, we need the other things. We need the nutrition, the lifestyle. We need the cutting edge, the hyperbaric, the IVs, the laser, all these things that we're using, the peptides, all the stuff that we're talking about in health optimization, overall health, biohacking, and these things. That's why I say it's the overlap of everything.
That's
So
amazing.
the idea in the future is we shouldn't need any dentists anymore, because a healthy body is immune against tooth decay in the first place.
Sure, makes complete sense. I'm really interested actually to talk about the kind of dental procedures and also the causes of poor oral health and the kind of strategies. Yes. Before we get on to that, what I did want to come back to is something you just said, a really interesting line there about how our teeth are organs and they are an extension of our nervous system. Could you just tell us a little bit more about that?
Yeah, I usually have a nice slide from the anatomy where you can see, so our brain stem is right about here, and we have 12 cranial nerves. One of these nerves goes to the eyes, one to the nose, but also there's one big one called the trigeminal nerve, which goes from here directly to your lower jaw, to your upper jaw, and to your eyebrow, kind of. And on this nerve, the end of the nerve basically are these little teeth. So your teeth have an immune system. They are alive. They are just hard as stone from the outside. But they're as sensitive so they can touch your hair. So inside there's an immune system, there's a blood supply. It's called a pulp. We have an immune system in there. We have an autonomic nervous system in there. We have a lymph supply. We have everything that qualifies as a regular organ. The same thing as your stomach or your liver or your pancreas. It's the same thing applies to your teeth. And it's 32 pieces of it right on that nerve. This is why it's so critical for your nervous system and immune system, because if anything is disrupting it, it could be that tooth here that is chronically infected, that makes your shoulder frozen, or your knee problematic, or even something connected to your breast cancer or whatever. So it's really, like I always say, the health starts in the mouth. The mouth is actually the entrance to your whole gut system. It's opening here and it's ending there. So you see, it's really important.
That's absolutely fascinating. And I know one thing that I know I sometimes talk about this when I'm teaching is how in Chinese medicine, there's a lot of discussion about how the teeth relate to certain organs. And you kind of alluded to that there. So is that something that you kind of apply in your approach?
That's all engraved already. So in the book, there is a chart, and it's called the tooth meridian chart or odontone. It's basically, it is the energy system. So Kramer and Voll, German guys, they found out the connection with the nervous system through electroacupuncture in the 60s, 50s, 60s. So German guys, and they just realized, oh wow, every tooth has a specific organ connection. That doesn't mean that a tooth has also other connections, but specifically, for example, the incisors here, those front teeth, are connected to your kidney and bladder meridian system.
Wow.
And therefore, they're oftentimes connected to your eyesight, to your neck problems, but also obviously to your hormones, to your kidney, to your detoxification. And for example, your top molar here is connected to your stomach meridian, which is also for women especially important because it's going the stomach meridian directly goes over your breast into all your female organs. There's one, it's just an epidemiological, not a study, it's more like a review from Dr. Rau from Paracelsus Clinic in Switzerland. He realized that from all his breast cancer patients, 94% had a root canal on that stomach meridian, which crosses the breast. Whereas the healthy patients, only 30%. So it's not a causation, but a correlation. And for various reasons. And same is with the cavitations. So everything, it's just basically, whenever you have any chronic inflammation, any toxins, any cytokines, whatever in your body chronically, being it in your mouth or in your shoulder or in your knee, whatever, it disrupts your nervous system and immune system over time. So it works systemically, all these things. It's not, your mouth is not a separate part, it's a part of your body. So you find, nowadays they find oral pathogens in hip joints replacements. How is that even possible? Yeah. It's super simple to explain, but for them it's like, how is that even possible? Yeah.
It's amazing. Absolutely.
How that works.
Yeah.
It's so simple. You have a lot of microbes. Your whole body, it's like 1/10 is just human DNA. The rest is just microbiome, basically. And your oral microbiome is the most diversified, and you have a few special strains that only exist usually in the mouth. For example, Porphyromonas gingivalis, which is associated to periodontitis. So if you have a periodontitis, which is basically a ongoing gingivitis, as an inflammation of your gum, plus underlying bone. If your gum is inflamed and opens up, it's the same as leaky gut. It's leaky gum, and then the bacteria just jump in your bone. Bone is inside body, and from there, within a minute, into your whole system.
Wow.
And this is how you find it in your joints. From replacements. And
now there's so much research out there pointing between, as you said, P. gingivalis, for example, one of those oral pathogens, with Alzheimer's disease and cardiovascular disease and fertility problems. And, it's really highlighting in the last few years. Diabetes, interesting.
Periodontitis and diabetes, periodontitis and heart disease, root canals and heart disease, root canals depression. There's so much information out there. And the WHO last year said that 70% of chronic disease is connected to the oral health. And they only looked at the cavities and periodontitis and gingivitis. They didn't even look for root canals and cavitations and the metal problematics.
Wow.
So
that's incredible.
And
what I find interesting actually is that even a lot of naturopathic practitioners don't tend to ask many questions about the oral health, about the oral cavity. And it's something that we're really at CNM trying to drill into our students. Always ask, when you go through the gastrointestinal section, the digestive section, maybe bring it up there and start asking questions, or in the previous surgery questions, procedures, etc. Because this is an area, like you said, that we're learning so much more about. There's so much more evidence out there. People like yourself obviously shouting loud, which is important to get this message out there.
Yeah, so your gut microbiome is directly the reflection of your mouth. So it starts in the mouth, also all the digestion. In my opinion, every health coach or doctor, let's just say everybody who is interested in health of their patient, should be able to diagnose a panoramic x-ray, and it should be diagnosed within the first session. Because if you forget to treat the mouth, it just takes so much longer, and sometimes you don't even heal. I have a lot of patients, even a lot of naturopathic doctors and even dentists and doctors are my patients. So really professionals. And a lady, she's also on Instagram, a patient of mine, she got pregnant and her baby came to this world, and I congratulated her on Instagram. And she's like, I blame it all on you. It's like, why? Yeah, because it happened 2 days after our surgery when you took out the cavitations and the root canals.
Wow.
And she's a gynecologist and stopped that and became a naturopathic doctor. And I said, okay, yeah, that's possible, because when you take out the chronic stress, your body can finally be in parasympathetic and you get pregnant. And I would probably instantly know 15 female patients that had the same experience, even more, because it's just that extreme. So you want to become pregnant and it's just not working, and you're doing everything already, everything. So you want to become superhuman, and you do the nutrition, you do the grounding, the earthing, everything you learn from biohacking. You do these hyperbaric oxygen IVs, and you still are not superhuman, you still can't get pregnant, you still have brain fog, you still are mentally depressed, then at least it's time to find somebody who is able to diagnose the oral system for the three health killers that I'm always talking about. And I think this, in my online course, for example, patients learn how to do this themselves. So you, Bobby, can do that yourself for all your patients, and initially are way better. Obviously, they need to be associated with a dentist who can work with this. Our patients come from all over the world anyway, so it's not a big travel from London or from the UK to see us in Germany. But we need to work on more associated clinics
Yeah.
that can help more people, because that's actually the bottleneck here. There are too little biology dentist specialists out there. I'm working with certification, guys, but if you're interested, shoot me. It's really, really important. They need you.
That's great. Thank you for sharing that. I know you mentioned in there as well about stress, and I think this is a good point to mention. You highlighted before that the teeth connect to the nervous system, and you mentioned there the autonomic nervous system. And just for our listeners, the autonomic nervous system has two parts. We've got the sympathetic part, which is our fight or flight. We've got our parasympathetic part, which is rest and digest. So just to clarify, were you saying that if you've got a tooth problem, that can keep you in a sympathetic state, so you're in a fight or flight state because of the tooth problem? Is that what you meant?
Yes, even further, goes even further. So some people are in chronic fight and flight because of it. Some people are even getting a toxic vagus syndrome from it. That means they don't even have any parasympathetic working anymore for 30 years. So
Wow.
they're in war zone every single day. They're nervous in the morning. They don't even know where it's coming from. They try everything. They feel so bad, and then just run root canal, for example. I'm just over exaggerating, but it's really like that. You need, at one point you need to have that stuff done, and this is how we do it. We approach it in an overall segment. So when you come see us, it's always everything: no metals, no root canals, no cavitations. We place ceramic implants. We can go into this later,
Yeah.
but just know we do it once and for all. And if that's finished, let's say after 6 months of healing, I will never see you again as a dental patient. Otherwise, you didn't learn, because once repaired, you should be able, with all the new knowledge about nutrition, lifestyle hacks, whatever, to have your teeth perfect, because nature designed your teeth perfect. You ruined it, not me. I'm very well aware of how to keep your teeth hard as stone.
Mm.
And if they get mushy, and tooth decay is the number one chronic disease worldwide. Over
Wow.
90% of people get tooth decay, even though oral hygiene is way better than 30 years ago. So we know oral hygiene theory doesn't work.
Yeah.
There's a little part of it, but the lifestyle piece is way more important.
Yeah. Interesting. I remember my kind of light bulb moment when it comes to oral health was a patient of mine who I've been seeing for about 8 months or so, kind of on and off. And she was a lady in her mid-20s and was diagnosed through some stool testing, actually, with really quite bad dysbiosis in her gut, so imbalance of her gut bacteria, and had lots of bloating, had lots of diarrhea, all sorts of things going on. And I basically threw everything at it. I threw all the antimicrobial herbs and the supplements and the nutrition and the lifestyle advice, and, thought this will do the trick. Okay, that didn't work. Let's try this. This will do the trick. And went down the line. I could not work it out. And then I kind of sat back one day and thought, I'm going to have another look through the case. Let's just work out, what am I missing? And the one thing that I'd missed was the fact that she had mentioned in passing that she'd had a root canal. And it was I think it was tooth 30, you might have to correct me on this, which I think is the first molar on the bottom. I might be wrong here. Definitely tooth anatomy is not my best area. But
First molar on the lower right.
yeah, the lower right, that was it. And so I looked at that and thought, okay, I'm going to check this chart out. I'm going to see if there's any link here. And what a surprise, the large intestine flagged up. So I said to her, look, you've really got to go get this sorted. So she went to a holistic dentist here, a biological dentist. She had the tooth removed, and they said, look, let's just get the tooth removed. It's rotting. It's a dead tooth. Let's take it out. And I kid you not, within a week, her symptoms resolved. And when she told me that, I thought, oh my goodness, I'm never, ever, ever again going to forget the oral cavity and the importance of oral health. So that for me was a light bulb moment. That's why I was so excited to have this podcast with you, because it's an area that we still just do not talk enough about.
Yes, and it should be in the initial examination of every patient, because it's so simple. Almost everybody, especially in the UK, had dental work done.
Yeah.
we still place amalgam fillings. Same in Germany. I think NHS still pays amalgam fillings,
That's true.
and dentists oftentimes don't even think about these things. They just train to do it, and insurance covers it, so they just do it, and don't even know that they ruin their health themselves, but also for their patients. It's not that they do it with bad intentions. It's
Yeah.
just a lack of information and knowledge. This is why I'm there for, and want to spread that word that all overall optimal health has a big link to your mouth, and no health coach or practitioner should miss it. Because sometimes they will take, I have patients, they have seen 29 different clinics for years and years and years, and they just still didn't fix it. They fly in from all over the world. We do the oral thing, obviously combining all the other parts, and 80% of their stuff is gone. And the rest, the last 20%, we will go deeper and deeper and deeper. And I work with different practitioners all over the world to help get your body to where it was when you came to this earth. That's the goal.
Fantastic.
But the mouth part is also, it's very important that we, because of all these patients coming in from all over the world, it was really critical that we make it as efficient as possible. That's why everything is basically automized, and you know exactly how to prepare the right nutrition, the lifestyle before. And then when you're there, we use just everything to get your body in a healing state. And then for the next 3 to 6 months until everything heals, you know exactly what to do and what your lifestyle looks like, your food design concept, and how to think in nutrients, which stuff to supplement, and what else, and what else. And then we do the final crown work and aesthetics. I don't even do that. I'm just the guy who removes the interference. I don't do any dental work. I'm just doing the surgery.
Interesting. And I think as well, from again, coming back slightly to the philosophy, I guess, in this and the approach, what we are doing from a holistic perspective is, and even what you're doing and what you're describing is, you're allowing the body to heal itself. You're taking out the blockages, you're taking out the things that would, are causing problems, and you're just simply allowing the body to do what it's been trying to do all along, because we forget how innately intelligent our bodies are at healing.
Yes, actually, that's exactly what I always say. I'm just there to help your body heal itself, but obviously, we will use everything possible to support your body in healing. For example, hyperbaric, IVs, the whole nutrition piece. And also, what is my specialty in surgery is I don't want to just rip out a tooth. I take out a root canal tooth and all the cysts and everything disinfected with ozone. And if that is clean, the goal number one, make it clean. But then your body wants to heal at that time. So that's the perfect timing to put something in there. This is my specialty, ceramic implants. A ceramic implant is not a titanium implant. It's a fully neutral zirconium dioxide ceramic. No electromagnetic waves can attach to it, and the whole tissue will grow on top of it. And if you place it at the same time as the extraction, it just stabilizes the whole anatomy. It's not that important for let's say, a molar, but for this tooth, you want to have something right away, because otherwise the bone is gone, everything is gone, and you just missed time and you need more time at the dentist. So I've placed over 5,000 pieces so far. That's why I'm still probably in the top 5 worldwide when it comes to this. And this was just important for me to become very specialized there, so that dentists listen to me when it comes to all the other functional medicine things that I'm doing for 20 years for my body, and being an expert in optimal health.
It's
And
really
people.
interesting. Really, really interesting what you're doing. And I know you've mentioned as well about amalgams. You mentioned about root canals. Let's get stuck into some of this. I'm really interested to hear what you've got to say about mercury amalgam fillings.
Yeah, so mercury was the one thing that actually got me started on that whole journey, as I mentioned before, because of its ugliness and non-aesthetically pleasing. So the mercury filling is this silver filling that you have in your mouth, maybe, and it's black and it's 50% mercury. So that got me thinking, mercury is the most toxic non-radioactive element known to man. How can I possibly place this in my patients? Would I do it for me? No, no way. Aesthetically not. Toxicology, I could never do that. And I realized as a dentist, we have to remove that stuff. So when we drill it out of the mouth, we have to bring somebody specialized to remove it as highly toxic waste. So I thought, wow, crazy. How can I put that in the mouth of patients? Even though it's a good filling and it works forever and it's for free and subsidized, no, not a chance. It's super toxic. It intoxicates you daily, and your body needs to compensate it. And at one point, it could be too much because if you Google or if you PubMed mercury with, like you said at the beginning, with any sort of symptom or disease, like let's say mercury and multiple sclerosis, Alzheimer's, or lead or other heavy metals, they all contribute to chronic disease. And this is our epidemic. I'm not saying that amalgam is the number one health enemy, but it's one of the number one health enemies to chronic disease. And we want to get rid of chronic disease. Acute disease, no problem. You go to the clinic, to the hospital, they help you, you break your arm, will be fixed. You don't die from an infection nowadays in the Western world. But you die from heart disease, you die from depression, you die from cancer, you die from decay, like brain decay, Alzheimer's. That's all connected to your epigenetics, your environmental stressors, like the mercury in that amalgam fillings. And that mercury is not tightly bonded. When you chew on the filling, when you drink acidic drinks, when you eat acidic stuff, when you brush your teeth, when you go to a professional cleaning, you always stir up more mercury vapor. It's about 2 to 3 micron per day, but if you grind or whatever, it's even more. And this is chronically intoxicating you because, mercury vapor goes through everything. There's no protection. It just goes into your cell and your cell has to die. There is no really a protection mechanism. For most people, they protect themselves by having a little bit more body fat, so it will get stored in the tissues, in the connective tissue, and in the fat. But very athletic, very sporty people, they don't have a lot of body fat, so they store it in their nervous system. That's why you see a lot of Parkinson's disease with, for example, like Muhammad Ali or any good sportsman, and there's always a connection to the heavy metals. Obviously, there's a lot of trauma too, but yeah.
Wow.
So I say, in my opinion, you don't need it anymore. We have way better material, also more aesthetically pleasing and less toxic. But critically now listen to this. Don't freak out, guys out there. You don't want to go to your dentist tomorrow and drill out these silver fillings because they won't do it correctly. You need to know how to remove amalgam mercury fillings safely. Otherwise, you get way more intoxicated. Then better leave them in there until you find a biological dentist that is certified to remove amalgam fillings safely.
So just explain the difference then. So what's the difference in procedure between kind of conventional and biological?
Conventional dentists will just drill it out. And if you see that, check my Instagram. There's a real, like where you see on a microscopic tooth, how it looks when you drill out an amalgam filling, how all these things just stir up in your whole mouth, the pieces. You will never get rid of that. And what we do, we have a 7-fold measurement. So we use, like locally, we have a rubber dam, which helps against the fragments that break out. We actually drill around the filling and break it out so that we don't even stir up a lot. We have a big machine in front of the patient. It's kind of like looks like a big oven tube, and it sucks up 99.9% of all the mercury vapor. Wow. It also obviously helps me as a doctor and my nurse, but obviously the patient. We have fresh air in the nose. In the cavity, after removing the mercury, we will put in a chlorella paste, and we also have a special suction that goes around the tooth called cleanup suction, which also better sucks it up, and using lots of filters, and also putting all our patients on the right nutritional protocol before, and a lot of binders, and we do IV nutrients around these removals, high dose vitamin C and other things that help with the immune system, because we don't want to make or stir up your immune system. So the goal should be, when you remove the amalgam filling, you don't want to cause more harm than you already had from the previous 20 years. So basically, it should be as perfect so you could do it with a pregnant woman. We don't do that with pregnant women, but if it would be necessary and life depends on it, then it would be possible with this approach.
It's interesting you mentioned pregnancy because, of course, mercury as well can cross through the placenta as it can cross through the blood-brain barrier. So yes, it's a horrible thought.
This is always when people are wondering, I have perfect teeth, never had any amalgam filling, but my cells are full of it. Always ask your mom. She quite sure had some mercury fillings, because my parents all had it. Like the generation before me or after, like say two for me, my parent generation, or probably your parent generation too, full of that stuff. Luckily, they had better upbringing, so more healthy when they grew up, because less fast food, less toxic environment. They could compensate the amalgam a bit better. But it transferred to the babies, and they were born with that intoxication, which could already alter a lot of things. It's connected to autism and all these things.
Interesting. And you mentioned as well in terms of the preparation, which I thought was interesting for the procedure, for the removal of the amalgam filling. So in the preparation, is that when you're kind of using high dose vitamin C, other binding agents, etc., or does that come
So
afterwards?
the preparation before is always, we change the lifestyle, the complete nutrition. But you have to see, for our patients, most likely come to do everything. It's the metal removal. We remove all metals, also all titanium implants, all gold, not just the mercury, safely. So this is mostly day 2 or something. So when they're in this week, we do everything. But before, lifestyle nutrition is number 1. Then obviously the right micronutrients to optimize the liver function, liver phase 1, liver phase 2, detoxification, just boost your body basically. And then during the stay, you get a lot of IVs. For example, high dose vitamin C, magnesium, minerals, carnitine, all the things that are needed. And afterwards, even more, maybe some DMSO or whatever. But no active chelation, because don't do any chelation, guys, when you still have the salts in your body. It will just cause so much havoc. You have to think about osmosis. And first of all, get rid of the salts. Otherwise, it's kind of like if you would do a chelation and you still have amalgam fillings in your mouth, it's like going in the shower and rubbing yourself at the same time,
Mm.
dry yourself at the same time. It's just not working, and it's actually causing problems.
And
And
just
I see it a lot, the timing. You cannot use DMSA or DMPS or any sort of heavy chelation while people still have the root or the main cause in their mouth.
just
And the mercury filling is still the number 1 mercury source in your body. It's not the environment, it's still the filling in your mouth.
and just for our listeners, could you just explain what chelation means? Some people may not know.
Chelation is something that, let's say, integrative medical doctors or even naturopathic doctors use a lot. It's mostly done with IV nutrition. And you put in a chelator is basically let's say, a molecule that has a strong capacity of binding heavy metals.
Mm.
And the problem is, if the source of the heavy metal is still in your mouth, your body just causes havoc by redistributing these heavy metals. So first, get rid of the source safely. Then what we do is build your body until everything is healed and stable, because you need a lot of minerals to build bone and tissue. But you would also need a lot of minerals for the detoxification. So we don't want to do both at the same time. We just use binders because all this oral, like removing all the triggers from your mouth, the metals, the root canals, the cavitations, is in itself the biggest detoxification you will ever have. Because if you see the stuff they really take out by hand and you put it on the table afterwards, you think, wow, this stuff is insane. And this you cannot detox with any IVs. You have to just take it out and then heal your body. And then if everything is also integrated, the ceramic implants are fine and stable, then we maybe do let's say, a urine chelation or hair mineral analysis and see what is next. And if there's any chelation needed to get that stuff out of the cell.
That's a
But
good point.
not as long as the stuff is in your mouth.
You mentioned the hair mineral analysis as well. So is that something that you tend to do to kind of look at how much is lingering around in the body post removal?
Yes, but yeah, timing wise, let's say 3 months after the removal and
Yeah.
when everything is quite healed, then we would do something like this. Or one of our, let's say, associates in other areas of the world will do this at one point. Yeah, because when you had mercury in your mouth, we know that within 24 hours, this mercury is in your bone and in your whole body. That's just it. And you breathe it in, you breathed it in for 10 years, 20 years, 30 years, sometimes even 50, 60 years. So your cell is probably full of it. Depending on how good your innate detoxification is. And you know, guys, detoxification is depending upon your daily nutrition and your micronutrients. And you will deplete those because you have to produce a lot of glutathione to get rid of it. And you need a lot of B vitamins, a lot of magnesium, a lot of minerals on a daily basis. And why don't you just deplete it?
Yeah.
So that's why we fill up and make you anabolic and help your body, like you said, to heal itself with everything we can. And then at the right timing, we will look deeper into these things.
That's really
if
interesting.
necessary.
I've also heard you talk about mercury and other heavy metals in terms of how they act almost as an antenna, which I thought was interesting. I'd listened to a talk you did at the Health Optimization Summit, and I thought that was a really interesting way of describing it. Could you just tell our listeners a little bit about what you mean by that?
Yeah, so I said at the health optimization topic, I said, okay, how about I tell you about the number one enemy to optimal health that probably 99% of you out there don't even know about and what you can do about it. And I asked the audience at one point, did you have any metals in your mouth? Any metals? And then stand up, please. And then I asked, I don't know if you've still been there. Then I asked about root canals. Who has a root canal or had a root canal treatment? 60% of the audience stood up. And then I asked, whom of you guys did they remove the wisdom teeth? And the whole audience stood up in a tribe of already optimizing people. So even there, 99% had still problems in their mouth. So metals is one of these enemies, root canals and cavitations. The metals comes with three different challenges. Toxicology, we just discussed it with the mercury. Immunology, because the immune system can always become allergic to mercury or any other heavy metal or any other metal because it's not supposed to be in your body. And third is always in this world of high loaded EMF, electromagnetic fields or waves, any metal in your body is going to be an antenna. And there is studies showing that if you have a phone call with your cell phone and you have a mercury filling, we have an increased mercury vapor output after this phone call or during that phone call, for example. Or if you have a titanium implant, it just heats up while doing the phone call, up to 3 to 4 degrees Fahrenheit, which means high fever at the spot. So the bone around the implant is always kind of dead. Yeah. So it's really a different environment. And since 2008, I think back then we reached the maximum exposure of EMFs. And I think the chart went like this afterwards. So it's exponentially. We don't even know how much EMFs we have. It's insane.
It
So you
is.
shouldn't have any metal in your body.
It's really frightening, and I know obviously you have spoken about EMFs and their role, and I know in the kind of health optimization world we're talking more and more now about the potential role of EMF in poor health and disease and so on, which is good that the message is getting out there. For people
Yes.
that, let's just say for a period of time, do have these metal fillings in their mouth, what kind of approaches do you recommend in terms of just getting by and trying to minimize EMF exposure? What are your kind of top tips?
The easiest tips always to minimize EMF exposure is number one, shut off your Wi-Fi at night. I think you probably will tell that to all your
Yeah.
patients. It's for free. Just switch it off at nighttime. Because what it does, you don't hear it, but if you have like a machine to make it, I don't know how you call it in English, a measure device
Yeah,
to
and
measure it,
that's
you
right.
hear the Wi-Fi. It's like, yeah, that's how it pulses. And this interferes with your whole system, especially if you have metals in there. Second one is you put this one on airplane mode. And no, your phone shouldn't be on at night, at least. I would say it now got dark. Usually I should wear my blue light blocking glasses right now. I just forgot them downstairs because I thought it's still sunlight out there. But I would use, so after it's getting dark, I would use blue light blocking glasses. That's not because of the EMF, but it's just also because of your exposure to light. Yeah, it's kind of an electric thing. But the main thing is Wi-Fi and switching off the to airplane mode. And I always have a thing. It's called I don't know how you call it in English. It's a little device that helps with EMS to kind of balance it out. It's called Vivo Base. We have it in the house. It's like it has a 32-meter radius. So whatever you can do. But obviously in my house there is no Wi-Fi. It's all on landline. I can switch it on to download stuff, but usually I don't need it.
Interesting. I know in our household we've got shungite crystals just about everywhere, and it was interesting because when I first found out about shungite crystals and how they can kind of reduce EMFs, I thought I need to see this for myself. So I got one of the EMF monitors, and first of all, super scary to put that to your mobile phone. That's enough to make you not want to touch your mobile phone much at all, and then to the Wi-Fi router, which is even worse. And then we put big blocks of shungite on the different devices, and the difference it made was really good. I mean, obviously it doesn't completely eliminate it, but certainly reduce it, which is good. So it's really interesting. And like you said there, if you've got mercury fillings and you're just having a simple phone call with your phone to put to your ear, which is a few inches away from that metal in your mouth, it's a really scary thought that you're just causing more and more mercury to leak into your system. It is
Yes,
frightening.
this is a real study. You can find it in my Instagram. It's PubMed. You can see it on PubMed.
I think I might have
I
seen this
did.
one.
I didn't make it up.
I think, if I'm not mistaken, was it from 2008 or 9 or something like that? I think the first study.
2008. I think it was really 2008. This is also when we reached the critical limit of EMF exposure, and now it's like exponentially. Nobody knows anymore what's happening.
Wow.
So I think it's important that you know about it and then take precautions. That's it. Especially if you have metals. And I personally still have micro antenna because I drilled out so much amalgam, mercury fillings. For the first couple of years, I only protected my patients and forgot about me. So I intoxicated myself too. So I know how it is if you're mercury toxic. So not that
Yeah,
good.
it's a good point. I bet dentists and dental practitioners generally are probably some of the most mercury toxic people,
You know
especially
that
when they're doing it
dentists
right.
and dental nurses, and I think it's psychologists and it's pilots, are always the three most unhealthy professions. And I think dentists are most likely the ones that have the highest suicide rate. And I think it has a lot to do with the exposure to all these various toxins. So you have to be really superhuman as a dentist to compensate all this if you don't protect yourself. But also, there's good studies showing that if you like breath in too much mercury vapor, you store it in your pituitary, and it is really interfering with your clear mind and clear thinking, and makes you a little bit blind to it,
Mm.
and you forget about the problematics here. And also, a second thing besides all these toxins is, as a dentist, you are too close to the patient. Usually, we never talk to somebody within this radius. Like we call it arm's length in Germany. But as a dentist, you're not on arm's length with your patient, you're on half arm's length. You kind
Yeah.
of have him here. So you have him in, you are in his field. And every patient in a regular dental office is afraid of the dentist. They don't even want to go there. They might even hate that appointment. So you feel all this negativity on a daily basis. The dentist, a regular dentist job is really not that cool. It is, you have a lot of work. You have to convince people that you want to do something better, but it's not covered by the insurance. Then you end up being the one who is only doing it for the drill, fill and bill mentality. So you think the dentist is only doing it for making it money. So the dentist tries his best and the patients don't like him.
Yeah.
So this is how we upgrade it. If you become let's say, a health optimization oral expert or whatever, what we do, then you get fans that come in from all over the world and they really look forward to their appointment because they know that something will change and that we are going to help them on their health journey as a success partner. That's it. That's what we do. Just be there for the patient 100%. And I have one to maximum three patients a day for surgery so that I can focus 100% on each single person. No stress, no like working in 5 different rooms to kind of like pay for everything because dental stuff is really, really expensive. Um, so that's
Interesting. And I know you'd also mentioned before a little bit about titanium and root canals. So just moving on to this, tell me a little bit about your thoughts on root canals.
so. First, titanium is another metal that's, if you lost a tooth, then you can get a new root, which is called a implant. And 99% of all dentists still place a titanium implant, which is a metal, titanium oxide. And it comes with the same problems that I just described. This is why I'm a specialist in ceramic implants, so I can place a root that is neutral, white, and your tissue loves it. It only osseointegrates with your body when your body is able to heal. That's why the nutrition side of things and the supplements is so important. That's just if you lost a tooth. A root canal is one of the three health enemies that is might maybe lurking in your mouth. And a root canal initially in conventional dentistry was a pain treatment, an acute pain treatment. Because if you ruined it and had a cavity that goes to your nerve, you have excruciating pain. It's trigeminal pain. It's really massive. You need to see a dentist to get rid of this pain. And this is how a root canal is performed. They take out the nerve supply, the blood supply, and then basically put some, let's say, medication in there, maybe even use some ozone, and then fill it up so that you have still the tooth for one reason, to bite on it. But it's a dead tooth from there on. It's not alive anymore. And it becomes the perfect cave for oral microorganism because there's no more immune system in there protecting that system. And if you see a tooth root in an electron microscope, you see that there's tiny dentin tubules, around about, let's say, 35 to 70,000 per square millimeter. So you cannot even count it. And if you add those channels from one root, it's about 1 kilometer in length where these bacteria can live and strive and produce their metabolites. So we have a chronic infection over time. That means if you have an immune system, you get a chronic inflammation, which is maybe a cyst and apical periodontitis on your tooth. But also these toxins that are produced as metabolites from the living bacteria in there are highly toxic, thyroid ethers and mercaptanes, which you can also get allergic to. So it's a double whammy. And the most critical thing is if you have a root canal with an amalgam filling on top, because then the mercury gets connected with the metabolites and even more toxic stuff develops. For example, dimethyl mercury, which is really, really toxic, and there's no more protection for your body. It's probably just in the microns, but still, it's something that you didn't want to have in your mouth. Also, third of it, a root canal tooth will rot over time because it's a dead organ and your body doesn't supply it anymore. And there will be a rotten byproducts from rotting, which is called putrescines or cadaverines, which should be underneath the earth, actually. That's why that stuff smells so bad.
Wow. Blow my mind. It's actually mind blowing. It really is. I think that when you said there about how you get basically, was it a kilometer of potential surface for the bacteria to
Yes.
thrive, these pathogens
in just,
one
just
tooth?
one root. And
Wow.
some of these teeth have like 3 roots.
That's
Molars.
that's really quite something. Really interesting though. And it is interesting because when you think about it, nowhere else in the body do we leave dead tissue. We don't leave a dead organ or a dead piece of tissue anywhere else in the body.
Yeah, think about a diabetic foot or diabetic toe. It's the same thing.
Yeah.
You would instantly cut it off because you know it will spread. But here, you just place it in your mouth, put a cap on top, and it looks nice because you can bite on it. But it's connected to your nervous system, to your lymph supply, blood supply, and all these toxins within a minute, they're in your system. High cytokines, TNF alpha, IL-1, like all these acute phase cytokines.
Yeah, it's a very inflammatory.
Through the roof. Yeah, the pro-inflammatory cytokines.
And this is, I guess, that's a key mechanism here. You know, if we've got somebody coming in with an inflammatory disease, whether it's an autoimmune disease or whatever it might be, this is how you can get the leakage of all of these substances into the blood, up-regulating your immune system, more inflammation.
More inflammation, and also the connection to the nervous system. So you have a stressed nervous system, you have all these toxins, and you know that your nerve here can transport whatever is in your mouth or in your tooth into your nervous system. So back into the ganglia, back into the sympathetic, back into the vagal nerve. That's called retrograde axonal transport. So if there's any viruses or fungi or parasites or mercury lurking in there, the nerve will transport this.
Wow.
There on, the whole nervous system again will be a bit more compromised.
Yeah, it makes sense. It's almost like constantly sensitizing your nervous system to.
It's really, really bad. It's traveling. It's called retrograde axonal transport. This was already, I think Sturdebecker found out about it 100 years ago in Sweden by just placing toxic oil into the cavities of a tooth from a dog, and just monitored where is this oil going. And within 24 hours, it was in the hypothalamus, was in the ganglia, was in the vagal nerve, like everywhere in the whole
Wow.
system. Yeah,
And
that's it. And I didn't invent it. It's there. There's enough research to understand how anatomy works. You just have to open up your anatomy book, and your autonomic nervous system is also very important.
very interesting. Very interesting. Thank you for sharing that. You've mentioned they're two of your biggest health killers, the amalgams and the root canals, if I'm not mistaken.
I'd say metals overall,
Okay,
root canals, and number three would be cavitations.
cavitations. Tell us a little bit about what cavitations are and why they're such a big issue.
The huge issue because they're not known and you don't study this in university. So this is something that comes afterwards if you're interested in it. Cavitations is the layman's term for something better called FDOJ, which is a abbreviation for fatty degenerative osteonecrotic jawbone. And this is basically what it is: mushy necrotic bone. How does this even happen? Whenever we pull a tooth and your body's not able to heal it, this happens. It's just a sign of poor recovery and hibernation mode, is what I always say, and too much of a traumatic surgery, maybe, that causes this in the first place. Which teeth are pulled the most in the Western world? It's the wisdom teeth. Why? Because we grow too narrow. Why? Because our nutrition is wrong. It starts with breastfeeding, it starts in the womb. So, Weston Price showed it 100 years ago. So, this is why most of my patients have cavitations. Most of your patients will have cavitations from their wisdom tooth removal. It can happen after any sort of tooth removal, but wisdom teeth is also very prominent in teenagers. And then they end up being chronically fatigued afterwards, or have an autoimmune disease, or irritable bowel syndrome, or skin rashes, or being depressed, or all of it. And nobody knows about it because you don't see it on a conventional x-ray if you're not trained to. This is why you need a three-dimensional cone beam, and you actually need to know that it's existing, because if you send a cone beam to any sort of maxillofacial surgeon or any dentist to diagnose it, and they don't know about that phenomenon, which is called FDOJ or cavitation, they won't diagnose it because it's not in their curriculum. They don't even know about it. So if you don't know about it, you cannot diagnose it. And this is something that is really missing in university. My good friend and the Yoda of cavitations, Dr. Lechner, did studies or research for the last 42 years. He's already 72 years old, and this is his life's work. I think he has 15 peer-reviewed papers already. But you can also find it out because in these cavitations, let's say these mushy degenerative jawbones, which are maybe at your wisdom tooth area, there is a specific, it's not it's not a cytokine, it's a chemokine, which is called RANTES, or you can find it medically with CCL5, chemokine lignin 5. If you Google Scholar CCL5 or RANTES plus multiple sclerosis, for example, or any other disease, you will find 3,000 references straight away. That means whole medical world is searching for where is this RANTES coming from, but they don't know it's from the mouth because the dentists don't even know. You understand? Right. It's really bad. And there's good studies showing, for example, through this ongoing inflammation in the jawbone from these cavitations, they found this RANTES hyperexpression also being connected to breast cancer. Crazy. It could be connected to always anything. Trigeminal neuralgia, migraines, all these things that are connected to your brainstem, brain fog. It's just always a lot of times these things, and the problem is nobody knows about it. And you could open up a miracle healing clinic and only do these surgeries, and people will tell you it's insane. Wow. I had the surgery. My nervousness was gone afterwards. My skin rashes were gone afterwards. My chronic back pain was gone. And I didn't even know that I had that. It was just by chance that we did a cone beam and found it. I was grinding at night like crazy and super stressed. It was just my body trying to compensate for that huge chronic inflammation surrounding my trigeminal nerve, which also probably contained heavy metals, glyphosates, and lots of chronic infections. Like mold. Mold lives in there for a lot of people. That's why a lot of American people come fly in, because they have a huge mold issue, and mold spores tend to live in there.
Wow.
And because of the heavy metal content, it's really, really nasty if you see that.
So it's not just the bacteria.
You personally, have you had your wisdom teeth removed?
I actually haven't, no. But I think everybody I know has. So I'm an exception.
Are they grown out or are they impacted?
They're at the moment they're okay. At the moment, the last time I
So
had
they
them
are in
checked,
line, grown out.
oh sorry, yeah, they're in
So
line.
that's good. That's you. That means you're more like a Neanderthalitic, and your parents feeded you well when you were a kid.
Good. I'll tell them they'll
Very
be
good. You
happy.
probably were breastfed. Ask your mom; she
I
did a good job.
was. And that I was actually going to ask you about that. So you mentioned before that one of the reasons we have so many people with wisdom teeth needing to be removed is because of breastfeeding, etc. Just explain what you meant by that in a little bit more detail, if you could.
So basically, the whole growth of your let's say cranium or your whole head starts with feeding, and the first thing you do is breastfeeding, ideally. And if you suck on a nipple or on the breast, you need 12 times more strength than from a baby bottle. And this strength develops this lower jaw to come forward and all this muscular structure. At the same time, when you suck, you have to breathe through your nose. So it also widens your palate. It is growing and shaping your whole jawbone. Plus, obviously, you get nice nutrients that you need to build. And then afterwards, if you would live in a rural area and you only eat the stuff that we're designed to eat, like Weston Price found out in Africa, but with the Aborigines and all these tribes he visited 100 years ago, he could see that these people were just growing perfectly because nature has it right. Because they had all their critical fat soluble vitamins, they had enough protein, they had no core four stuff that I call core four. That means gluten containing grains, no sugar, no refined vegetable oils, and no conventional dairy. It wasn't existing, so they just grew perfectly. But their relatives, the teenagers or the kids, they looked like our teenagers. Crowded teeth, mouth breathing, plaque, chronic gingivitis, gum inflammation, and bad breath, cavities, and no space for the wisdom teeth. So he already drew a correlation between industrialized foods or the core four and how you grow naturally with your natural environment and your breastfeeding and your right food. So I personally
Interesting.
also grew too narrow. I didn't have time space for my wisdom teeth. They all got removed. I had braces twice and it didn't even work. So my kids, they do it better for sure. My
Good.
wife was breastfeeding. I think the first one 18 months, and I think the last one was almost 2.5 years.
I was actually going to ask you that. So, is there a kind of an optimal time that you
Yes,
would recommend it
yes,
to ensure that
minimum.
this is developing?
Yes, minimum. If possible, all women out there that can breastfeed, I'm sorry about that. There are other solutions, but if you can, and you are eating healthy and you're already free from all these toxins that are going through your placenta and your breast milk, then it's the best thing to breastfeed for 18 months, 1.5 years, or even longer, but not less if you can, because then the jaw is kind of built.
Fantastic.
And you
Fantastic.
know that the teeth are already developed in that age. Even the adult teeth are coming through. So even though they just grow out when these kids are five or like it starts with 6 years old, the root, the dental bud is already there. It's already there actually in the womb. So
Interesting.
mm,
Very interesting. Okay. And so, you've mentioned there about breastfeeding. In terms of more kind of general dietary issues, when we look at kind of poor dental health as more of a general subject, what are your big culprits that you look at?
so in the food design concept, there are basically two charts. One is a red chart, which is don't lose health in the first place. I call it, I just said it, the core four that you should always avoid, because if you eat these foods, the most pro-inflammatory industrialized foods, then you actually lose health every single day. Gluten-containing grains, or grains in general, in my opinion. Refined vegetable oils is probably the baddest of everything. Then sugar, but every dentist will tell you about sugar. And let's say conventional dairy. And I'm not talking about raw A2 dairy, which is way too complicated because almost nobody can get it. So let's say just most dairy that you will get is conventional dairy and not good for you. It's nothing to do with the dairy that you had from a cow that was living outside, eating fresh grass every day, and then fresh from the, I don't know how you call it, fresh from the nipple. So that's the call for. Don't lose health in the first place. Avoid these sickeners. And then the green chart is thinking in nutrients. Why did I design it thinking in nutrients? Because there's so many patients coming in with various different mindsets regarding food. One is doing carnivore, the other one is doing vegan, the third one is doing low carb, high carb, intermittent fasting, keto, paleo, autoimmune paleo. There's so many different mindsets, and I don't want to interfere with your mindsets. I just want to teach you how to live optimally within that mindset. That's why thinking in nutrients makes sense, because you will learn about how to design your macronutrients: protein, healthy carbohydrates, healthy fats, and as well as your micronutrients: vitamins, minerals, trace minerals, and amino acids, etc., to support your body in his um, ongoing growth and repair.
Interesting. Okay, and in terms of kind of nutrients, really core nutrients that you're looking for when it comes to the health of the teeth, what are
Yeah,
your key go-tos there?
it's kind of like the basics for optimal health. It's vitamin D3 and vitamin K2, because they are very important for your bone and tooth mineralization, as well as various other things related to your immune system, hormone system, etc. Then omega-3 fatty acids, specifically triglyceride based, really from animal, not concentrate. Then the critical minerals will be magnesium and zinc, because if you test patients in their red blood cell, they're mostly depleted in these, because you need a lot of them in that stressful world. And a lot of these foods deplete you of it. For example, grains, chelate minerals, and vitamin C. Those are the absolute basics when it comes to micronutrients. So let's say the daily basics.
Yeah.
And then if your nutrition is on point, the number one macronutrient deficiency is protein, and therefore amino acids. So I would always have in my bone healing protocol, there's always essential amino acids, plus even more amino acids, as well as some collagen and various different proteins to help you get to the daily protein requirement that I think is ideal. And this should be, in my opinion, it's about 2 grams per kilogram of lean body mass, or your ideal body weight. So for a male, it's probably I'm 84 kilograms and quite lean, let's say 10%. So my ideal is about 150 grams of protein a day,
Okay.
roundabout. So that's how I calculate it. And these powders will help. And then healthy fats and carbs is just depending what type of diet you would prefer. So if let's say you're a patient and you're more like a carnivore, highly parasympathetic person, probably, who has a better digestion for heavy digestible foods, because red meat, eggs, butter, all is very, very hard to digest. And on the other end, we have more the vegans, or let's say vegetarians, or more the Mediterranean food, which is more monounsaturated fats and leaner proteins, more sympathetic persons that need more plants. That's just a simplification. I would also look at your HRV, heart rate variability, and your body type. So I'm a typical mesomorph person. My average HRV at night is about 60 to 80. So I'm a balanced body type, but I need a bit more carbohydrates, and I'm not as good with the carnivore. I can do carnivore, um, but I need carbs.
Yeah.
I'm an athlete. I just need fuel,
Sure.
and it doesn't work so good with fats. They just don't burn as quick. Let's say compare yourself with. I would be the sports car needing 25 liters on 100 kilometers. Some people are more the truck. They need six liters diesel, and they can just eat once a day and eat a huge meal, and they're super satiated because their body's just assimilating everything. That's not working for everybody out there. I'm also just timing all these different nutritional approaches individually. So,
Yeah.
for example, almost all my patients won't fast after the surgery, even though they're a big fan of intermittent fasting because it's a trend. No, because I want to have you be anabolic and not in a separate stressor. Because people mostly feel very good. Because first of all, when you fast, you skip a lot of these bad foods that I just mentioned, the core four. You also reduce calories most likely, because you don't know about the timing feeding window, and just reduce overall calories. But you're putting a toll on your adrenal glands, and you're already chronically stressed because of your oral problems. you don't want to add more adrenal fire, cortisol, adrenaline. Even though it feels good to run on cortisol, adrenaline, I'm a junkie too, or have been. So I know how that feels, but it's not the best for your overall system.
You know, you highlight some really good points there in terms of individualizing, because it's, you know, I think we have to be careful sometimes, don't we, the role that we play, and in terms of if somebody's got a kind of a deep belief system around their food, and they really for some kind of ethical reasons, for example, really don't want to eat meat,
Yeah.
then it's not
Okay.
our place to sort of go, right, you need to go and do that. So it's good that you're just highlighting, okay, here are the nutrients you need, and based on your dietary preference, this is what you need to be particularly conscious of. So I really like that.
That's why I call it thinking in nutrients, and it's an umbrella above all the mindsets, because I don't
Fantastic.
want to take it away. Because if you don't like to kill an animal, that's fine for me.
Yeah.
Then just eat plants. But plants are also living, so they don't want to be eaten too. They can't run away. So you have to ferment, all the things that you
Yeah.
need to do so
That's
that you can really eat them. You cannot just eat beans. They will just kill you from the inside.
Yeah, yeah, absolutely. Now, I wanted to ask you about toothpaste, and in particular, your thoughts and your views around fluoride toothpaste.
Yeah, in biological dentistry, you would never use fluoride toothpaste. No toxins allowed. So basically, everything you put in your mouth, you should be eating. I would never eat all these chemicals that are in a conventional fluoride toothpaste. It's just not necessary. It's a strong disinfectant. It kills your oral microbiome, plus various other things. And it's not just the fluoride. There's SLS, and it's basically a soap. Sometimes there's even sugar in it so that it tastes good again. So a general toothpaste is just not recommended. And better you do your DIY version on a coconut base, or you just buy one that is as natural as possible. The best one is not existing yet. Wait for it; it's coming.
From you, Dr. Dom?
Yeah, I'm always
Maybe.
planning new things. Of course, of course.
So if somebody...
I get that question a lot, so that's why I'm saying it's not there yet. But there are many more thinking in this direction. Yeah.
So if somebody was to look for like a pre-made one now, I appreciate what you said there, that there isn't the ideal one. What are the sort of things people should be looking out for?
I would just go into a health food store and look for something that is free of almost everything.
Okay.
Yeah, and if you cannot read or spell or know what is in there because it's so chemically, don't do it.
Yeah.
Just buy the one that says coconut oil and says herbs and whatever, and that will be fine.
Okay. And you mentioned...
Because the cleaning is not as important as the food that you're eating.
Yeah. And you mentioned there coconut oil as well. What are your thoughts on coconut oil pulling?
Yeah, my 3 oral hygiene tips are fluoride-free toothpaste or chemical-free toothpaste, no chemical mouth rinses. Therefore, we do coconut oil pulling, which is an ancient Ayurvedic strategy, where you just basically use a tablespoon of coconut oil, put it in your mouth, switch it around for 5 to 50 minutes, and then spit it out. It will just soothe your whole pellicle, your saliva, your teeth, your gums, and also basically detoxes all the fat-soluble toxins plus bacteria. It's also strongly antiviral because of the lauric acid in the coconut. And the third thing is a copper tongue scraper. That's the 3 things I would recommend for oral cleaning, oral hygiene.
And what daily copper tongue scraping?
Yes, daily copper tongue scraping, if possible, daily or every other day. Coconut oil pulling would be great, and once a day brushing would be great. If you have a ton of dental work done, I would probably do twice a day brushing. But if you have perfect teeth like myself, no need to brush if your diet is on point. There is no fur. I only brush because I don't want to smell bad.
Yeah.
That's it.
I'm sure
It's
your
not
patients
for
are probably quite
cavities.
happy.
I don't brush my teeth because of cavities. That's bullshit.
That's really good. It makes a lot of sense. What I'd like to do is, as we just now draw this to a close, is just ask you one final question, really, just for you to kind of summarize for our listeners. What are your key take-home messages from today? Just for the people, what is it that you really want people to kind of take away and understand from this podcast?
Yeah, first of all, whatever you're suffering from chronically, or why you're listening to this, or you want to optimize something, there's always a solution. And the first thing is always why you want to do this, and that you take responsibility for your ongoing optimal health journey. And this is fun because you will adopt daily new habits that you can do in terms of getting you to optimal health. It's an investment. Yeah. Whatever you do from now on, you don't want to lose health anymore through various things. and whatever you do on a daily basis should give you a little bit of dividends in terms of optimal health, longevity. And a big part is actually oral interference. So these three health killers that we talked about, if you had any metals in your mouth, stand up. If you had a root canal, stand up. If they took out your wisdom teeth, stand up. Then you have something that you can improve on. And at one point, you need to see us or any other trained dentist to do so. But before you do this, you can optimize your health using nutrition, my food design concept. You can use the right micronutrients. You go out in nature. You shield yourself by don't using Wi-Fi at night and switching off to airplane mode and all these things that we talked about. I designed a whole online course for my patients as onboarding, but you can probably with I don't know when the podcast is coming out. I'd say probably right now already get that online course, which is about these 80%. But you will also learn what is in your mouth, all these oral healthcare strategies, as well as how to diagnose your own panoramic X-ray. Plus, you will know how to think in nutrients, how to microdose you, how to the micronutrients, etc. pp. How about it's basically all my knowledge in there so that you can prepare yourself for the upcoming surgery or like whatever happens. Your body should be able to be healing at all times. That's why it's kind of like a blueprint to optimal health starting from the mouth.
Amazing.
And this is my message for you guys. It's all in your hands. I think we should all work in terms of co-elevation. Everybody who heals itself is inspiring other people to do so because we need change. I didn't want to suffer when I was 20 years younger. I had to, and I would love to know this guy now, 20 years ago, who could just tell me, okay, you have to do this, 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 and this in order to get healthy. There are solutions. You will find them, and it's going to be legendary.
I think it will be. And there's no doubt that health starts in your mouth. I think that's one thing that's come through very, very well. So thank you so much, Dr. Dom, for your time. I know you've joined us late from Germany after a busy day in your clinic. So thank you so much. And I look forward to doing more with you down the line.
Yeah, you're very welcome. And whatever you want to get in touch, I think you have some show notes. Probably easiest to see me on Instagram, Dr. Dom1. And there's a tab bio where you find my clinic and a link to the book and all these various things. But I think you probably have it in the show notes.
Absolutely. We'll pop it in the show notes.
Then you can get in touch. You can come in from all over the world. I'm happy to help all you guys if possible. And obviously, we need other dentists that also want to learn this. So we can even help more people.
Agreed. Well, Dr. Dom, it's been a pleasure. Thank you so much.
Thank you so much, Bobby.